On this week's episode of Dr. Marla and Friends, you had it during your teenage years and now you're dealing with it again. We take a look at some of the latest treatments for adult acne. Also, blood pressure. You need to pay close attention to it, but maybe you're still not doing enough. Dr. Sheldon Tobe tells us how you can take matters into your own hands. And when alcohol becomes an addiction, our panel shows us how much is too much. Plus, Dr. Yubi sets the record straight on some common health misconceptions.
I'll let you know if you have to worry about an increased risk of cancer the next time you reach for a diet pop.
It's a battle many of us think is over once we leave high school, but adult acne, it's much more common than you may think. Doctors have a few ideas about what triggers the breakouts, but more research is needed. That being said, there are a number of treatment options out there that can help you battle those blemishes.
I have a lot of acne problems, adult acne problems. It's kind of persisted through my youth, through my teens, and I carried through. Not so, in the past 3 years, it's gotten a lot better, but I get frequent breakouts and flare-ups.
Adult acne is something which we still have a problem with. In the 30s, women in their 30s really have acne, about 35% of them. And in their 40s, about 25% of women have acne. In the men's side, it's about 20% of men in their 30s and about 12% in their 40s have acne. So we see acne as a continuing process, and it's becoming actually more common.
The worst age would probably be in my 30s. It just really began bothering me because I thought this should be done when I'm in my teens. And I began seeking treatment a few years ago to try and calm it.
The first thing that we do is we want something to unclog the pores, because the basic mechanism of acne, the first step which occurs in the acne process, is that you get the pore which is blocked. Okay, Matt, we're going to do this photodynamic therapy we discussed. So we're going to apply onto your skin a special cleanser, and then we're going to apply the Levulan onto your skin. Okay. We're going to paint it on with a little stick, and we're going to let it dry, and you're going to sit here for about an hour and let it soak into your skin, let it get into your oil glands, let it get into the bacteria that we want to focus our laser light on, and then the light will shine on for about 8 minutes or so. Okay? One of the other procedures that we do is photodynamic therapy. And this is a procedure where we apply to the skin a solution called Levulan, and we let it soak into the skin for about an hour. And this solution, this aminolevulinic acid, gets incorporated into the oil glands and into the actual bacteria. Okay, Matt, I'm going to clean your skin now with this acetone solution, and it helps to take off the oil, the dead skin cells. So it's going to allow us to apply the Levulan nice and evenly on your skin, and it's going to allow the laser to penetrate effectively. What we're going to do now is we're going to apply the Levulan, this active medication, onto the skin.
It's one of those things where once you do start going, you wish you'd done it 5 years earlier. It's boosted my confidence. It's really cleared up my skin, and I've just felt really great since.
So the next step now is that we're going to shine this blue light, this laser light, onto your face for about 8 to 10 minutes. So let's put the goggles on first because we want to protect your eyes. Okay, I'm just going to position the laser light over your face now, and everything's in position. So Matt, just relax, don't move. Everything's ready to go. You'll probably feel a stinging sensation. It'll be mild after a few minutes, but that should be no problem. So this is the time now where the light is activating the Levulan, and it's going to cause the reduction of your oil glands and is going to cause destruction of the bacteria that's involved in the acne process. We're done now. We're going to turn off the machine. Very good. Now, let's take this off here. We'll move the machine away from you. Now, we'll take the goggles off. How you feel?
I feel great.
Good. Stinging a little bit or not bad?
Not bad.
Okay, excellent. So what we're going to do now is I'm going to wash off the solution with just some plain water. You've got your home products to use. You've got some prescriptions.
Yes.
And you've got the Zeo products.
Yes.
So you're going to follow that normal routine. But for the first few days, don't put anything on.
Okay.
Don't put your acne medication on tonight because your skin's just been treated by the laser. We don't want to add anything on which causes more dryness. And in a few nights when your skin settles down, then you'll start resuming your acne treatment.
Okay.
And then I'll see you in a month, and we'll review how you're doing, and we'll see if we'll do another photodynamic therapy session.
Sounds great.
Okay, excellent.
I would suggest that it's well worth it. Definitely. I've seen great improvements, and I continue to.
Acne treatment's become way more high-tech than it used to be, but certainly has great results. If you'd like more information on this or anything else you see on the show, head on over to our website.